Good morning and welcome to the 2020 Georgia Agricultural Labor Relations Forum. We're pleased to welcome you to the 5th annual forum that was born out of the collaboration of agricultural commodity organizations spanning from produce to livestock, cotton to peanuts. This is the second of 5 days of this year's forum that will be conducted entirely online. We have a lineup of ag labor subject matter experts to guide you and to answer your questions about labor, address any fear of regulatory issues, and to provide guidance to help you make the best decisions for your operation. Please make a point to thank and even give your patronage to our sponsoring organizations. Our presenting sponsors include the Georgia Agribusiness Council, Georgia Farm Bureau, and the Georgia Fruit and Vegetable Growers Association. Our gold sponsors include AgWorks H2, Georgia Cotton Commission, Georgia Milk Producers, Georgia Peanut Commission, and Georgia Watermelon Association. We have 2 silver sponsors that includes Premium Peanut and Southeastern Cotton Ginners Association, and our bronze sponsor, Insurance Office of America. Again, today is the second of a 5-part webinar series to help break up the weighty nature of agricultural labor issues. Amanda Feldposh, a senior epidemiologist consultant at the Georgia Department of Public Health, will be giving a regulatory guidance on managing COVID-19 with agricultural employees, as well as Travis Vance with Fisher Phillips will be overviewing preserving your company's brand, your business during a pandemic. I am Beth Olson, the Director of Education and Food Safety for the Georgia Fruit and Vegetable Growers Association, and today I'll be moderating this webinar. Before we get started, here's a few housekeeping items. Please note this webinar is being recorded. All paid registrants will receive access to all 5 webinars of the 2020 Georgia Ag Labor Forum for on-demand viewing. All content provided during the forum is meant to be an aid for decision-making and create bridges for attendees to those who have adequate legal and regulatory insight. So please do not consider any advice received as legal advice. No conversation will be held in confidentiality, and there is no client privilege during the course of these presentations and Q&A. To ensure you have the high-quality experience, please close all internet browsers and programs not needed during this webinar. All attendees should be muted as they've entered the webinar. However, we would ask that you would continue to please mute your computer, microphone, or telephone. As a quick overview to GoToWebinar, the presentation viewer should be on the left side of your screen, and the webinar control panel should be on the right side of your screen. The webinar control panel is where you can control your audio mode, such as joined with computer or telephone option, ask questions, and raise your hand. Note the webinar control panel will collapse automatically when it's not being used by the attendee. But don't fret, if you can't see your control panel, simply click on the orange arrow button and it will open up again. When you joined the webinar, you had to select your preferred audio mode from either the computer audio or the telephone dial-in option. You can change between these 2 options on the control panel. If you've joined with your computer or smart device and you're having trouble with audio, please make sure that your computer speakers are on and turned up. If you continue to have trouble hearing, try using the telephone dial-in option on your webinar control panel. Today, we're going to take all questions through the written submitted questions text box. Simply text or type your question into the questions text box and press send. Send is crucial. At the end of each presentation, we will attempt to answer all submitted questions. However, if we're running short on time and can't get to all the questions, we'll gather answers from the presenters and be able to communicate all those answers to the individuals. And lastly, I'd like to draw your attention to the handouts box on the webinar control box. The handouts box contains links to today's presentation as well as this housekeeping guide. So now, with these housekeeping items behind us, let's get to the webinar. The presenting sponsor and host of today's webinar is Chris Butts. Chris, I'd like you to join me. Thank you. Chris joined the Georgia Fruit and Vegetable Growers Association team in 2020, following 12 years with the Georgia Grain Industry Association. He works on many leadership initiatives with the Georgia Fruit and Vegetable Growers Association, with a heavy emphasis on state and national legislative and public affairs issues. A proud Bulldog and native of Athens, Chris currently serves on the University of Georgia's College of Agricultural and Environmental Sciences Dean Advisory Council and is past president of the Advancing Georgia's Leaders in Ag and Forestry Advisory Board. So Chris is going to tell us a little bit about the Georgia Fruit and Vegetable Growers Association and their work around ag labor. Then he's going to introduce our speakers and their topics. Chris?
All right. Good morning. Thank you, Beth. With today's focus on COVID, I'll talk a little bit about GFVGA's response. And if you rewind and think back to March of this year, there was an incredible amount of uncertainty around how our lives and businesses would operate. This included our farms and food processing operations. And when we started out with incredible disruption to the food service industry, our focus quickly became what we needed to do to keep GFVGA members open for business. Thankfully, we've avoided the worst case scenarios. We think this is due to the proactive measures our members took to keep themselves and their farm workers safe. On our end, a lot of credit goes to our friends and partners at the Department of Public Health, who provided us with Georgia-specific information geared at keeping farms safe and operational. We've met weekly during the pandemic, and they've been a great partner in our efforts. With that, it gives me great privilege to introduce Amanda Feldschwa, a senior epidemiologist consultant on the COVID-19 response team at the Georgia Department of Public Health. Aside from her weekly calls with us, one of her many roles includes leading the farm worker outbreak team at the state level. She formerly served as the Zika epidemiology team lead and zoonotic and vector-borne disease epidemiologist for DPH. She's a returned Peace Corps volunteer and received her MPH in global epidemiology from Emory University and joined DPH in 2013 as a CDC CSTE applied epidemiology fellow in the acute disease epidemiology section before moving into her current roles. So as you can see from that bio, we're glad to have her as part of our team and providing us guidance. So with that, I'll turn it over to Amanda.
Thank you so much, Chris. We love acronyms in public health. I think everybody does, so works out well. So thank you guys all for being here and for welcoming me to this group. And I'm here just to talk a little bit about COVID-19 public health preparedness, as well as some of the regulatory things that may affect our agricultural partners during this unprecedented pandemic. So I'm not going to spend much time talking about coronavirus with you guys specifically, because I know everybody knows a lot about it at this point. So some of the things, though, that I do like to kind of point out is that coronavirus is a large family of viruses. Some of the viruses do cause illness in humans, some only in animals, and some are what we call zoonotic, so they may be passed between human and animals. Some of the things we've seen in the past that fall into this are MERS and SARS, which I'm sure a lot of you guys remember, you know, the things in the news about that. Those are viruses that we still see quite often. And now COVID-19. One of the things that I do like to point out is there are actually 4 seasonal coronaviruses that circulate in the US. It's important to remember those are not the same as COVID-19. So sometimes you'll have somebody who tests positive for coronavirus, but it may not be specifically COVID-19. And it's just good to keep those 2 things separately. Those 4 viruses that do commonly circulate, they typically cause symptoms just like the common cold. So it's important to keep those distinctions separate. But I do want to take this moment to talk just for a brief second about flu. You can't be in public health without pushing for people to get their flu shot. As we go into flu season, we have seen co-infections with flu and COVID-19. So that's something we definitely want to avoid if at all possible. Additionally, flu symptoms are similar to COVID-19. So taking precautions to prevent flu will help to avoid confusion about whether or not an employee or someone you're connected to has COVID-19 or flu. Of course, the flu shot is not perfect and someone may still be infected, but evidence shows it does lessen severity of illness and it prevents illness in many. So getting a flu shot is a good way to try to protect your workers, encouraging flu shots. Maybe giving them on site if that's possible, or telling them where they can get them for free. Things like that can be really helpful in just, putting in a layered protection, which we're going to talk a lot about during this time today. Okay, so the big thing we're going to talk about today, what I've been in most of my career has been emergency preparedness and response. And so my biggest thing is to be prepared and to have a plan. So our number one priority is the health and safety of our people. That includes, employees, people who visit your establishments, people who work with you, who work for you, families of those people. The number one priority is obviously their health. But having a plan in place can help to protect your people and also the continuity of business at the same time. They're not mutually exclusive. So we want to be able to give everybody the tools they need to be able to put that plan in place and to be prepared. One of the things that I'm going to talk about quite a bit is how these requirements are supported by executive and administrative orders in Georgia, and how having a plan in place about some of these recommended things may help you to be prepared to actually implement those required things that are addressed in the administrative and executive order without much disruption, because you're already doing the things that are recommended that will help you be prepared for that. I've left at the end quite a bit of plan time. I have a website link, and we'll plan to go through some of the Georgia Department of Public Health website to show a little more about where to find testing resources, as well as a bit more of an explanation about the data that is available on our website. So I'm going to refer back to this website in a bit. But I also wanted to point out some of the resources that are available to you all, which is our GDPH website, which we actually, as Chris mentioned, we've been working with Georgia Fruit and Vegetable Growers Association, as well as Department of Agriculture, UGA Ag Extension, many incredible partners to come up with and hone in on some resources that will be added very soon. So to the right of the slide is a screenshot from a checklist that is in the final stages of approval at DPH. In the meantime, I've referenced it here. CDC does have an agriculture employer checklist and webpage that is very similar to ours. So what we have done is we've actually adapted it for Georgia in a way that we think is just a little more usable. There were some things about the CDC one that we just felt perhaps not all employers would be able to implement. So we've updated that. We've also included some links to, again, Georgia specific guidances. There are differences, and we'll talk a little more about this later. There are differences to Georgia's guidances from CDC, and this is typical to most states. So CDC's guidance is often kind of a starting point, and then states will add things specific to their state that are related to the COVID-19 landscape in their state. Or the specific resources within their state. So this checklist should be live very soon in the next week or so. But again, in the meantime, the CDC Agriculture Employer Checklist and webpage is very helpful as well. And we just want to also point out, to utilize the resources available from Department of Ag, Georgia Fruit and Vegetable Growers Association, your academic partners, reputable and reliable sources for COVID-19 information. So we're going to talk a little bit about the checklist because it outlines a lot of the things that we recommend to have in a plan. And also the required things within that. One of the things I do always point out at this time is that Georgia is a state with 18 health districts and 159 counties. It's a lot of counties for a state that is our size. Again, those counties are distributed amongst those 18 health districts. Some of the health districts are a single county. So for example, Fulton County is its own health district. DeKalb County is also its own health district. Some of our health districts in South Georgia or in North Georgia may have 10 or 20 counties within their health district. So we always recommend throughout any of these talks that getting in touch with and creating relationships with your local health partners will be really helpful. Although we are all working towards the same goal, different health districts may take a slightly different approach to achieving that goal. So it's good to just be in touch with them and to have a relationship so that you can best utilize those resources that are there for you to support prevention of COVID-19 and to support you all as an industry as well. So the sections we're going to go over briefly today, again, a 10,000 foot view within those sections are assessment, screening and monitoring of workers, managing sick workers. This is a really important one that I'll spend a little extra time on, talking a bit about quarantine versus isolation, as well as essential worker considerations, which certainly affects our agricultural partners. And then layered preventions. So we talk about layered preventions a lot, and what that has to do with is just that we know that things like mask wearing, social distancing, hand washing, cleaning and sanitizing, we know those things work, but that they work best when you use as many of them as you can. So layering those preventions on top of each other. So, if you have two people who are both wearing a mask, that's great. If they are 6 feet or more apart, that's even better. If they're washing hands, if they're not sharing items like phones, if they're not sharing pens, if they're not, shaking hand, things like that, that's even better. We just really want to, again, promote that layered prevention approach. So for the assessment, we want to kind of touch on some things about planning ahead. So again, that's going to be the theme of what I'm talking about, is that planning ahead is going to help you be prepared for those things that are requirements. So we recommend definitely getting in touch with local partners. That doesn't just include local public health, though I think that is personally a great one to be in touch with, though I'm probably biased, but also local health partners. So some of the things that we've seen along the way is, and I'll talk more about testing in a few minutes, but we've seen when somebody, an employer has someone who needs to be tested, that if there's not a plan in place prior, sometimes they end up scrambling to find a place to be tested. And oftentimes they may end up going to a place where either the test type is not ideal or cost is really prohibitively high. I'll talk more about it in a bit, but testing at the health department is free. There's also several other healthcare providers that do offer free testing. So being aware of what's available in your area, and this is another place where it may vary by health district or by county, because you may have local health partners, so local hospitals that have drive-through clinics that may be free with some insurance, or they may be free without insurance at all. For the health department, you do not need an ID to be tested. So that's a great opportunity to have people tested who may not have identification available. We also encourage providing information to your employees from reliable and up-to-date sources. We see a lot of stuff in the news, and there's a lot of things that are taken out of context. And, we all know that things can get really heated, especially with how much just emotion is around COVID-19. So making sure to reinforce reliable sources. So again, CDC, your state health department, your local health department, Department of Agriculture, your industry partners like Georgia Fruit and Vegetable Growers Association, any of your leading groups for the section of agriculture that you work in, the Poultry Federation, things like that. Like all of those groups have incredible people who are working to provide really accurate information. So making sure that you provide that to your employees helps to kind of point to those resources as opposed to those news cycle things, which may be proven incorrect in the next 24-hour news cycle. Again, designating a workplace coordinator is really important for COVID-19. Having someone who helps you out with providing this information, with being a liaison with workers so that they feel comfortable sharing information, making sure that that coordinator is letting you know what the preferred languages are and the appropriate literacy level of the workers can help you to provide information that is helpful and accurate. What we see a lot with any employer is that even if you have incredible prevention measures put in the workplace, if people, if your employees are not given good information about COVID-19 prevention outside of the workplace, a lot of that can be undone. So having, again, someone who helps to provide information about prevention of COVID-19 within the workplace and also outside of it can be really helpful to prevent issues within your workplace, because if someone's infected with COVID-19 outside of the workplace, that still impacts you. And we'll talk a little bit about that going forward. So again, contacting local public health about testing ahead of time can be really helpful, so that you have that plan in place. So screening and monitoring workers, there's a whole section on this within the checklist, and again, within the CDC ag worker checklist. We really encourage you to develop a plan for screening and monitoring your workers, and then being prepared with a plan for what to do if one of them does show up to work with fever or report symptoms. So being prepared to isolate that person quickly, and also thinking about the people who are screening your workers and making sure that they are practicing good layered prevention measures. One of the biggest things, I know we've all seen it in, going to Kroger or Walmart or whatever, is people wearing masks below their nose, or even worse, on their forehead or under their chin. If you have somebody screening workers who's not wearing a mask consistently and correctly, then it doesn't provide the protection that we know that it will provide if they're wearing it appropriately. One of the things I point out here typically is a CDC report that came out about some hairstylists. So there was a group of hairstylists who all tested positive. They ended up having over 160 clients that came in that were considered close contacts. So they were within 6 feet of them for more than 15 minutes. But this particular salon was very fastidious and very strict about wearing masks, both for the employee, staff member, as well as the person receiving services. And they had no secondary cases. So even though they had over 160 people who spent a significant amount of time around these positive hairstylists, none of them went on to develop COVID-19, but they were very strict about everybody wearing their mask and wearing it consistently and correctly. So we know that wearing masks consistently and correctly are very effective. And so we just want to really reinforce that, people wearing masks below their nose or wearing it on their forehead or wearing it under their chin is not the same thing as wearing them consistently and correctly. Another thing to point out here is that some recent studies have come out showing that the time between for close exposure, so we've talked about close contacts being within 6 feet for more than 15 minutes, that all of that time doesn't have to occur at the same time. So let's say you spend 5 minutes with your mask off with a coworker in the break room at 8, and then another 5 minutes at 12, and then another 5 minutes at 3, and another 5 minutes later. What we're seeing is that those additions of time, so that cumulative time, we're seeing infections based off of that. So again, consistent and correct usage of masks, practicing social distancing, practicing those layered protections are really what's effective, as opposed to kind of nitpicking the details of, well, I was only around them for 14 minutes with my mask off. So, this is really important, again, with considering those that you have screening your employees. So people who have a lot of contact with your employees coming in, making sure they're wearing masks consistently and correctly, they're washing hands often, they are, not touching people as much as possible, they're keeping distance as much as possible, things like that. And that will help to prevent additional positives if you do have someone come in who is sick. We also want to encourage people to report their symptoms immediately if they have them. Coming to work sick and then later finding out that they have COVID-19, it just increases the number of potential exposures, the number of potential people who may go on to develop illness. So we want to encourage people to report symptoms as soon as possible. Again, promoting mask wearing consistently and correctly is the really big issue there. And then the other layered protections like social distancing, hand washing, things like that. And then something that I'm going to get into a little more, again, is to know the legal requirements for workers who are sick or who have been exposed to someone who is sick and plan ahead for those things. Okay. So we talked about symptoms with screening and monitoring workers, but one of the things is that we have to remember that the symptoms of COVID-19 have expanded greatly over the response. So I think a lot of people typically think of cough, sneezing. I know a lot of people, you'll be in Walmart, you hear someone cough and you're just like, but that's not the only, signs and symptoms. We have had a lot of people for which their only sign or symptom was a new loss of taste or smell, nausea or vomiting or diarrhea. So it's important to, if you have an employee who is sick, even if those symptoms aren't respiratory, to make sure that you have them go home and to keep them away from others until you're sure that it's not COVID-19 or you have some other reason for why they're ill. Symptoms, if they are going to occur, typically appear 2 to 14 days after exposure. The average incubation period is about 5 days, but it's really important to also remember that many people have very mild symptoms or no symptoms at all. So it is rare that severe cases occur, but it's also good to be prepared for that as well as an employer. So all of these things are important to keep in mind when making a plan. One of the things that we will talk a little bit about is that when we are looking at people who have been exposed to someone with COVID-19, so you have a positive worker and we're concerned about who may have been exposed to them during their infectious period, that period of exposure of concern actually starts 2 days before their symptoms started, if they have symptoms, or 2 days before their test, if they were asymptomatic. And so that's why we really want to stress that although testing is an important part of the overall plan, we really do not encourage using a test-based strategy for prevention. So just because an employee was negative last week does not mean that they'll be negative next week. It is rare what we call maybe a closed pod or a closed community. So, somebody who gets tested and then has no possible other exposures that occur after that, that's going to be rare. Again, there is an incubation period that may be anywhere between 2 and 14 days. So you may be tested today and be incubating that virus and could be positive as soon as tomorrow. Sometimes, you may be positive, but you're just not shedding enough virus to test positive. So again, without getting too in the weeds on it, we just want to encourage that testing is important as a part of an overall plan, but it should not be the only thing. So just because someone is negative does not mean it's okay for them to, come into work and not wear a mask or not practice social distancing, because again, they may have experienced an exposure after that test or even still have been incubating the virus when they were tested. So we do say, please have a plan for testing before you need it. Your local health department will test you or your workers for free, but you do need to make an appointment. So you can find phone numbers or instructions for scheduling online at this webpage here, and I'll show you guys this webpage at the end, assuming we have enough time, which I think we will. But again, because of our districts, our 18 health districts, some districts do appointments online. Some do it by phone. So going to this webpage will show you the best resources for free testing in the area that you are in. One of the other really great things about public health testing is that it is a PCR test, which is the gold standard for COVID-19. So you'll know that what your workers are receiving and what you are receiving is the best test available. There may also be, again, I mentioned it earlier, pharmacies or drive-through testing sites in your area, but we do encourage you to ask about cost before making an appointment. And also about things like the type of test, the turnaround time, just being aware of those things ahead of time is really important if you have testing as a part of your overall plan. So this kind of comes into the start of talking about managing sick workers, and that thing I mentioned earlier about really understanding and knowing the differences between what's required for a worker who has tested positive versus a worker who has been exposed to the virus but is not positive for COVID-19 and is not showing symptoms. So quarantine is a term that we use for someone who might have been exposed to the virus, and it keeps them away from others. So this is someone who has not tested positive yet. So who undergoes quarantine? Again, people who have a known exposure to COVID-19, but who have not currently tested positive for the virus and who do not have symptoms of the virus. I'm not going to get too far into the weeds on it, but what I mean by currently tested positive is that there is evidence of reinfection. So if you have someone who had COVID-19, for example, 5 months ago, they tested positive 5 months ago, but they have since recovered and they have now had another exposure, we would say that person has not currently tested positive, though they did test positive 5 months ago. But this would be someone who basically we just don't believe has COVID-19 right now, but has been exposed to someone with COVID-19 and may develop the virus. Again, that person would now possibly be in an incubation period, which may be up to 14 days. Isolation separates someone who is infected or thought to be infected with the virus from others. So people who undergo isolation are people who have tested positive for COVID-19 or who are expected or suspected, to be infected with COVID-19. So when we say suspected to be infected, we sometimes will have people who do not seek testing, but just for an example, maybe someone in their household has tested positive for COVID-19 recently, and now that person has symptoms of COVID-19, but doesn't want to seek a test. We would suspect that that person's illness is COVID-19 because we know they have an exposure to COVID-19 and they have symptoms consistent with COVID-19. People who we would not include in this would be someone who, let's say, has seasonal allergies and they know they have seasonal allergies, and we wouldn't say, oh, just because that person has the sniffles, they're suspected to have COVID-19 if there's no other reason to think that that's COVID-19. So quarantine, again, you were exposed as a close contact to someone with COVID-19. So talking about how long quarantine lasts, again, the incubation period for COVID may be up to 14 days. So it is 14 days after your last known exposure, as long as you remain healthy and asymptomatic. If a person develops symptoms of COVID during their quarantine, they will actually be subject to isolation at that time because they have a known exposure to COVID-19 and they have symptoms that are consistent with COVID-19, they would be suspected to be infected with COVID-19. There are some exceptions to aspects of quarantine for essential personnel, which I'm going to talk about in just a couple of slides. Isolation, again, is for someone who is infected. So you are infected with COVID-19 or you believe that you are. So again, maybe you have a known exposure and you have symptoms consistent with COVID-19. Isolation lasts at least 10 days since symptoms first appeared. So 10 days since your symptoms appeared and you have not had a fever in 24 hours without using fever reducers and other symptoms of COVID-19 are improving. Some common questions we get about this, is do we mean all symptoms of COVID-19? So if the person had vomiting, does that need to be improved? The answer for that is yes, but also we do want to encourage, if you have an employee who is vomiting, nauseous, or has diarrhea, they probably shouldn't be working anyway, but we do want to see that all of the symptoms of COVID-19 are improving. For someone who tested positive who did not have symptoms, so they were asymptomatic, 10 days needs to have passed since their positive test, again, as long as they remain asymptomatic. There are some caveats to this. If a person has severe COVID-19, a weakened immune system, or other underlying conditions, a healthcare provider or infection control specialist may recommend that their isolation lasts longer than 10 days, but that is a decision that they would make with their healthcare provider. So some things about essential workers. So Homeland Security does have a list of essential workers, which most states follow. There are some minor exceptions in Georgia, and any state is able to adjust that list as they want through executive orders or administrative orders. There are no adjustments to agriculture at this time, and I don't anticipate that there would be. We know that our agriculture workers are absolutely essential, but just so you're aware that there is a list of where critical infrastructure workers can be found. So talking a little more about isolation and quarantine with essential workers. So Essential workers are not exempt from isolation. So again, isolation is staying away from others if a person is suspected to have COVID-19 or has tested positive for COVID-19. Essential workers, however, may be exempt from some aspects of quarantine. And again, quarantine is if a person has had exposure to the virus, but we do not expect or suspect that they are currently infected. So they have remained asymptomatic, they haven't tested positive, and we just know that they've been exposed to someone who is positive. So Georgia follows the CDC guidance, which allows essential workers to continue to work after exposure if the essential work cannot be maintained without them. However, additional precautions should be taken, and I'm going to talk a little bit more about this now and why it's so important to you. So to the right is an excerpt from that guidance. So any essential worker who is working after being exposed to COVID-19, they should be pre-screened. They should get regular monitoring for symptoms. They should wear a mask consistently and correctly in the workplace for their entire quarantine period. You should also try even more than anyone else to social distance these employees. One of the things we would encourage would be if this employee typically works in a position where they can't social distance from others, consider if they can be swapped out with someone where they can. And then make sure to disinfect and clean all their workspaces. And, you may look at this and say, these are the things that are recommended anyway, and they are. But again, with these workers who have a known exposure, there's a reasonable chance they may go on to develop COVID-19. And I want to refer back to something I've already spoken about, which is if you have an employee who tests positive, our concern for time period for exposure is 48 hours prior to symptom onset or 48 hours prior to a positive test. So if you have someone who is working, even though they have been exposed and they develop COVID-19, you're going to have to look back at the 48 hours prior to when their symptoms started or they had a positive test if they are asymptomatic. And you really want to make sure that you have as few people as possible that are exposed to them, because what could happen is by allowing these people to work, if it's not necessary, is you could just create more and more positives and exposures within your facility. So we really, again, encourage, one of the things they talk about in this essential worker guidance is cross-training, thinking about ahead of time about who is essential, and also how you might be able to move people around, so that if you do have somebody working while exposed, perhaps you can have even more social distancing for that person. Is there any aspect of their job that would allow teleworking? Just kind of thinking through all of these things with the employees that you have, with the departments that you have, and being prepared ahead of time to be able to implement, again, isolation. Essential workers are not exempt from that. That is for someone who has tested positive or is suspected to have COVID-19. But, considering that in your plan for allowing essential workers who are in quarantine to still work. And then, in summary, for managing sick workers, make sure to have plans for isolation and quarantine. So again, for isolation, the person's, if they work in a facility like any sort of like warehouse, anything like that, having a plan for what you would do when you have people out. For quarantine, again, thinking ahead and identifying who's essential, how you might be able to cover their work function if they needed to quarantine, or, again, thinking about how you might be able to move them around or set up barriers or do whatever to layer those preventions. Cross-training employees, again, to allow for quarantine when possible. It may reduce the number of additional exposures and required isolations if others become positive. And then do not allow or encourage people to return to work until they have completed their isolation criteria for people who are sick. So now we're going to talk a little bit about some of the layered preventions. So getting kind of out of some of those specific regulatory or requirements, those are supported through our administrative orders and executive orders at DPH. So if you have questions about those, I'll show you guys where you can find that administrative order at the end. So some of the things you can do to kind of prevent exposures within your facility. Again, when we look at close contacts, we're looking for people who have spent more than 15 minutes cumulatively within 6 feet of a person who was positive during their infectious period. One thing I like to point out here is that although we have seen that wearing masks is very effective in preventing transmission, wearing a mask doesn't keep you from being a close contact. So adding social distancing will be really important, because at that point, if a person is wearing a mask and is also more than 6 feet away from someone, they would not be considered a close contact and would not need to quarantine. So some of the engineering controls here is, again, mostly surrounding social distancing and touch-free things when possible, but being creative in ideas for barriers or social distancing is encouraged. Nothing's one size fit all. A barrier doesn't have to be made out of, it doesn't have to be fancy, like custom made out of plexiglass or anything like that. Like, some things like hanging a curtain or something like that can be really effective in creating those barriers. So we really encourage, thinking about what you have available and how you can make that work for yourself. Cleaning, disinfecting, and sanitation. We really encourage promoting hand hygiene. I think you see a lot of jokes about this online that who knew it would take a pandemic to have people wash their hands. But this is something that helps to prevent other things as well. Again, we're going into flu season, so even if it's not COVID-19, flu may be something that is a concern for you, other viruses, things like that. So providing hand washing stations, clean water, and soap, and encouraging people to wash for 20 seconds. A lot of people say sing happy birthday twice in your mind. That will give you a 20-second wash time. Hand sanitizer is great, but it does not replace hand washing. So we do encourage providing hand sanitizer, but also, again, providing the accurate information to your employees that it does not replace washing your hands. We also recommend reviewing EPA information on cleaning and disinfecting in the workplaces. Talk to people who are experts at this, like Beth, and really kind of understand what you need to do to clean and disinfect between groups. And things like tools, preventing sharing of those, and if you can't, at least cleaning and disinfecting between people who use them, and doing it, again, appropriately and in a way that is effective. So administrative controls, this goes into providing training for COVID-19 that's easy to understand and in preferred languages and at the appropriate literacy level. And this goes back to that assessment and identifying a workplace coordinator that can help you to identify those languages and identify those literacy levels, and make sure that people are getting information that is helpful and that they're able to digest themselves. Review leave and sick policies and plan ahead. This is the first page of the booklet that I mentioned earlier. That is a collaborative effort between a lot of groups, and that should be going live fairly soon. So, utilizing something like that provides some information on COVID-19 can be really helpful. One of the things that may impact some of our agriculture partners is shared housing and shared transportation. So the checklist that I showed the screenshot of, it's in Excel format, and there are tabs for the different sections, and some of them may not be relevant to you, and some may only be relevant at certain times. So for example, managing sick employees will only be relevant when you're actually managing a sick employee, but it's good to review it and be aware. For those of you for which shared housing and shared transportation impacts you, there's quite a bit of information in our farm worker guidance, as well as agriculture guidance from CDC, that has information about sleeping head to toe if you are sleeping in, if you have multiple people staying in the same housing, and also, again, with that creativity, thinking about adding curtains between beds for added protection as a barrier. For shared transportation, you'll see at the bottom there's a picture of a bus. We know that keeping 10 people in a vehicle is ideal, 10 or less, excuse me, while still maintaining social distancing, mask wearing, things like that. But we know that's not always reasonable, especially if you're a business or organization that utilizes some of the larger vehicles. So in those, there's ways that you can do it, things like skipping seats or using a zigzag pattern, as you see here, that maximizes space between people who are riding. Also keeping windows or vents open when weather permits. And again, really encouraging consistent and correct mask wearage. And finally, trying to cohort people. So if you have people who live together in the same housing. You know, if you can cohort them and have them work together, have them ride together as much as possible, it can be really helpful in kind of minimizing the number of exposures you might have if someone does become positive. One of the things I do want to point out here is that even if you aren't a facility that utilizes shared transportation officially, if you have workers who travel together, so maybe they use public transportation or they carpool or van share, you know, this kind of information can be really helpful because, again, if something happens and they're not practicing those prevention measures outside of work, and one of them tests positive, it may impact all of them who do that ride share together. So making sure that they know how important it is in their daily lives to practice these layered prevention measures can help to protect your workers and also, you know, again, business continuity. So here's just kind of a summary page for preparing businesses for outbreaks of COVID-19. So again, a lot of the things we've talked about, have a plan to continue your essential business functions, cross-train personnel where you can, assess your essential functions and, you know who is essential and how you might be able to maintain them working if they are exposed while minimizing exposures to others if that person does go on to develop COVID-19. Reinforce those healthy behaviors like hand washing, covering their cough or sneeze, and again, get a flu shot. It's the perfect season for it, and you know, encourage your workers to do that as well if they are able. Again, hand washing and disinfectant, sanitizing, things like that. And then one of the things we didn't talk a lot about, but monitor for and discourage stigma and discrimination in the workplace. We all know so many cases of COVID-19, and we don't want anyone to be stigmatized or discriminated against because they test positive or for any reason that may be related to COVID-19. So being aware of that can be very helpful. So the last thoughts I have, I'm going to click on this dphgeorgia.gov site and show you guys a couple of things in the last few minutes and take some questions as well if anybody has any. But we just want everybody to stay calm and be prepared. Reach out to your local public health and other health partners. And again, all of those partners like Department of Ag, Georgia Fruit and Vegetable Growers Association, any of your industry partners in your specific industries, you know, make sure that you're communicating with them and just have those relationships in place ahead of time. And make sure to get your information from reliable and accurate sources. Prevention, not panic, of course. So let's see here. So just a couple of things, again, with the time that we have, I wanted to point out was this is our Georgia Department of Public Health website. I'm gonna try to scroll here. So you can find testing if you come here and click on this COVID-19 testing and scroll down to the bottom. So there's actually some really good information up here about the type of tests that can be done and what they mean, which can be really important. What does my test mean? Even with a negative result, you should still practice standard safety protocols. That again goes back to what I was talking about a test-based strategy not being sufficient for prevention within a business. But for example, if you are located in Northwest Georgia Public Health District, you can find local testing locations and hours at this website link. And I believe you can actually make an appointment at that link. You can also call the individual counties if you would prefer to do that. And we have that listed for all of our health districts. So you can see, for example, District 3-1, Cobb Douglas, you know, that they serve just Cobb and Douglas. Fulton does just Fulton. So again, each of those districts may handle the scheduling different, but the thing that is the same for all of them is that it is free and it is a PCR test, which is again, the gold standard. I also wanted to point out, so we have a new website for farm worker guidance. So on most of our guidance web pages, you can actually find the administrative order for public health control measures here. That's a PDF that can be downloaded. And so, you know, that's a good place to look to see what the actual administrative order says about isolation and quarantine as it may be updated over time. You can find at this page, we will soon have that workbook or booklet, excuse me, as well as the as the agricultural checklist. But again, you can find the current agricultural checklist on the CDC webpage, which goes through all of those same sections we spoke about. And then the last thing I'll show you guys is our data for the Georgia Department of Public Health website. So you guys can access this at home. We have county indicator reports, which again are reports by counties, which may have some helpful information for you. Additionally, we report our confirmed cases as well as antigen positive cases. So I talked a bit about the different type of tests. Confirmed cases in Georgia reflect PCR positives. Antigen is another type of viral test, but it is not considered to be as strong of a test as PCR, so we do report those out separately. But some of the things I show down here is you can actually look at our COVID cases over time, and also at individual counties. So you can actually, click on different counties. So if you see this drop down here, this is something that was easy to miss. So you can actually choose an individual county. So for example, since it's first on the list, we'll pick on it. But you could look at, this is just the cases for Appling County. So if you want to take a look at that. Some of the things I point out about the data is that if you think about someone becoming positive for COVID-19, they develop symptoms. Let's say it's a symptomatic person. They develop symptoms. It takes them a couple of days to be tested. The test takes a couple of days to come back, and then it takes another day or so to be reported to the public health department. So after that person became infectious, it may be 5 or 6 days before that lab result or that person is actually reflected on the website. So we have some information on the webpage about, excuse me, sorry, don't want to give you guys whiplash here, but we have some information about, some of our latest case counts. You may see those go up because, again, of those delays in reporting. But this can give you just some information, again, about your county, about the state as a whole. But we just encourage, kind of using this. We continue to try to update it to provide more and more information. We try to provide as much information as we can while still protecting the people who are positive and protecting their protected health information. But we continue to add things. So this last week, we actually added the antigen positives. We added the county indicator report a couple of weeks ago, and we'll continue to add things and try to improve upon this dashboard as time goes on. So with that, I think that's all I have. So if anyone has any questions, I'm happy to answer them or whatever is needed.
Excellent. Thank you. Thank you very much, Amanda. Always great information. And I would definitely underscore Chris's comments and thoughts earlier about the relationship that we as the Georgia Fruit and Vegetable Growers Association have created with you guys in the weekly meetings that we've got with you all, and just how helpful that's been. It's been wonderful to create that working relationship, and I just want to give the audience just an assurance and an excitement that we really have got some fantastic regulatory organizations with our Georgia Department of Agriculture and our Georgia Department of Public Health. And so it's just been wonderful to work with that. I do have one comment that I'm going to turn into a question from Cindy, and that is, will the new farm worker booklet be available in Spanish or other languages?
Yes, so it will be available in Spanish. So again, I mean, I know I said it during my presentation as well, but we've just been incredibly grateful for the collaboration we've had, not only with Georgia Fruit and Vegetable Growers Association, Department of Ag, other groups as well, but especially with Beth and Charles and Chris. We've learned so much about the agricultural industry, which I think has been incredibly helpful to us. So I talked about our checklist and how we adapted it from CDC's because we thought some of it wasn't as reasonable in practice. And a lot of that we learned from our experiences with you guys. And what our goal is to make this usable for people and not just to say, well, this is what you have to do and, good luck. So we really want to make this like effective and usable. And so the booklet to that point will be put out in Spanish. So the English version is completed. Beth is core on this as well. We have sent the text for Spanish translation, and we've been told by the graphic designer it'll take a couple of days once we get that text back to get it in Spanish. So we anticipate the Spanish version just to take, maybe 5 days or so longer than the English version, just because we had to wait until we had that version to do it.
Excellent, thank you. Another thing that, well, let me remind the audience, if you do have questions, make sure that you type those into the question text box, and then that way we'll get them and we'll be able to answer them. So that, again, we're taking questions through the written submission of questions in the answer in the questions text box. One thing that we continue to run into with a bunch of our growers and packing facility operators is being able, or the question of, can you test your way out of isolation? So if there's an employee that is positive, has tested positive for COVID-19, and therefore they're in that 10 or 14-day isolation period, can they, at day 5, 6, 10, go get a test? And if it's negative, can they come back to work?
It's a great question, and I'm glad you brought it up. So I'll answer that question as well as another one that we commonly get associated with it. So again, isolation, as you said appropriately, is for someone who has tested positive. Technically, a person can test out of isolation. So that's if they've tested positive before. Their isolation is 10 days, but they have to have 2 negative tests at least 24 hours apart. We, as well as CDC, heavily discourage this for a couple of reasons. One, logistically, by the time they go get a test, the results, you have to have 2 at least 24 hours apart, and then you have to wait to get the results for both. So typically 10 days will already be up. But the biggest thing is that science has shown, and there's stuff in our return to work guidances and all over the DPH page about this, but people will typically test persistently positive even when they're not shedding virus that is infectious to others. All of the evidence that we have, the data that we have, says that after that 10-day period for someone who's not severely immunocompromised and wasn't severely ill, once they meet those isolation requirements, so 10 days since their symptoms started, at least 24 hours after fever has resolved without fever reducing medications, they're good to go. A lot of those people may still test positive. And again, evidence shows that what they're shedding is not replicative. It's not infectious to others. So we really discourage using the test-based approach because the odds are that person is going to test positive, and you can't ignore a positive result. So if they complete the isolation requirements, they are their symptoms have improved. It's been 10 days. They no longer have fever. They're good to go. But if you continue to test them and they continue to test positive, we have to recommend that they continue to isolate, even though we know it's probably likely that the virus they're shedding is not infectious to others. The question, though, we often get is about quarantine. So again, someone who has an exposure but has not tested positive yet, can they test out of quarantine? And the answer for that is no. And the reason for that is that the incubation period may be up to 14 days. So even if you get a negative test on day 9, that's great, but you may still be incubating the virus, or you may be so early in your infection that you just weren't shedding enough for it to test positive. So for quarantine, that is a strict 14 days, regardless of any test results received during quarantine. Again, isolation, you can technically get out of that if you've had 2 negative tests. But again, it's just not logistically or practically a good option. And again, neither DPH nor CDC recommend pursuing that for those reasons.
Got it. Thank you. Those are definitely 2 of the questions that we continue to get. Again, for those of you that have been in contact with us or have called and had questions, most of the time, once you ask a question about what's going on from a regulatory standpoint, Chris Butts, Charles Hall, and I typically have a little campfire And then we reach out to Amanda and her counterpart, Julie, at the Georgia Department of Public Health, just to make sure that we're on the up and up and giving the right information. And then we reach back out to our member or our industry partners and continue to give that guidance. So definitely some of the same things that we've heard. So thank you for that. I've got one last question. And I thought this was an interesting one. And it said, could you ask Amanda to expound upon establishing a relationship with the local health authorities? It seems it could be a bit awkward knowing that you haven't had any cases, but you want to reach out and start a relationship if and when you do. So I hope I never have to know you, but just in case.
No, I think, so, you know, I think I can speak for a lot of the districts that, you know, a lot of times we may hear through the grapevine in some way. So we may get a report from a lab, and then a person tells us that they work for whatever facility, and we've never talked to them before, and we don't have a contact. And, you know, I'm really fortunate if it's farm related, as Beth said, for, you know, her, Chris, and Charles, I just turn around and reach out to Beth, Chris, and Charles. But, you know, if they've never talked to you before, it can be difficult for them to find a way to contact you. So I think those district epidemiologists are really grateful to just have an email they can refer back to. I've had this happen with UGA in particular. Just a very specific example. About 2 years ago, I had someone from UGA reach out. They had seen my information somewhere, sent me an email and just said, hey, we don't typically deal, this has to do with rabies. We don't typically deal with rabies stuff, but like, I just want you to have my information just in case. And I actually used it about a week ago. I was able to find it back in my email just from remembering that interaction. And that probably saved a couple hours of work trying to track that down. So I definitely agree it can be awkward, but for public health, if we're doing our job right, nobody knows we're doing it. And so we're used to that, you know, reaching out and like, we hope we don't ever need this, but here's my information just in case. And that way, you know, if they hear through a hospital that, oh, hey, we've tested 2 people that work for so-and-so organization, they might have your information and they can reach out to you and just kind of say, hey, we've heard this, and you can close that gap really quickly. So I think they'd really welcome it. And, you know, just making that contact can be really helpful. Again, if you have questions, then you know who to contact in the future. And sometimes, you know, you call a district and it may take you getting passed around a little to find that really good contact, just like it would in any business. And so then you'll already have it. And that, again, can save you time. It'll save them time. It'll just make those connections even faster.
Excellent. Thank you. I do it all the time.
Yeah.
Just make it not awkward. It's okay. Excellent. Well, that's all the questions that we have. Amanda, thank you very much. Thank you for working on behalf of not only the fruit and vegetable industry, but I know that y'all have been active in the poultry industry and the cotton industry and the peanut industry. So just thank you very much for your continued work and for working on our behalf and working to keep our operations open and for really taking that logical approach of COVID is simply, it's now a part of the day-to-day working atmosphere, and you and your organization are there to help lead us and guide us to operate with COVID in the equation and to keep our offices open and our business going. So thank you very much.
Thank you.
With that, I am pleased to bring Chris Butts back from the Georgia Fruit and Vegetable Growers Association to introduce our next speaker. Thank you, Chris.
Okay. So in this real world of COVID and working from home, I have 3 leaf blowers that have decided to show up right outside my window. So Beth, if this goes astray, we'll send it back to you, but I'm going to try to get through it the best we can. So pleased to introduce our next speaker, Travis Vance of Fisher Phillips. He's a partner in the firm's Charlotte office and co-chair of the firm's Workplace Safety and Catastrophe Management Practice Group. He is also a member of the firm's COVID-19 Task Force, a cross-disciplinary team of attorneys dedicated to advising employers on the many workplace law aspects of the global coronavirus pandemic. Having gained a reputation as a professional and aggressive advocate for his clients, Travis has emerged as a thought leader in the field of workplace safety. His writing and interviews are followed closely by experts in the safety arena and have been featured in premier publications such as Bloomberg Law, Business Insurance, The Washington Post, EHS Today, and The Wall Street Journal. Travis has tried many matters across several industries and various subject matters, including employment litigation, business disputes, and matters prosecuted by the Mine Safety and Health Administration, OSHA, the Occupational Safety and Health Administration. He uses unique or outside-the-box approaches to counsel employers and owners on all aspects of employment law and the development of preventive policies and procedures to avoid employment and workplace safety-related claims. Travis handles litigation in both federal and state courts, as well as claims pending within state and federal agencies, including the Equal Employment Opportunity Commission, MESHA, OSHA, and the U.S. Department of Labor. He's a member of the Rotary Club of Charlotte and speaks frequently at Rotary International events concerning the growth of membership within that organization. His passion for making a difference in the lives of others has led to requests to share his message as far away as Canada and the Cayman Islands. He also serves on the board of directors for the Blue Ridge Safety Association, a trade group for safety professionals. Travis, given the highly regulated nature and delicate balance found in OSHA regulations, Travis is fully tasked to guide us through it. So with that, I'll turn it over to you, Travis.
All right, thank you so much, Chris. Appreciate it. And thanks to Beth and everyone else for giving me the opportunity to speak. And thanks to Amanda for doing a great job during her presentation as well. I really appreciate what she had to provide as well. Good morning, everybody. Travis Vance, as Chris mentioned, and sort of the best way I could find to let you guys know more about the pandemic and best practices was I was going to really rely on the lessons learned that I've gained through this pandemic. For me, it's been a really unique, rewarding and challenging experience. And I'll start off with sort of how I got involved in this as a workplace safety attorney and sort of just give you the backdrop, and then we'll go through some of the best practices that I've seen by companies during the pandemic. It was late February, the last week of February. Our law firm was having a conference in person in Fort Lauderdale, Florida. And we were having 65 or 70 in-house attorneys there. We asked them, who wants to hear a presentation about this pandemic? The coronavirus was just now being talked about. The stock market had plummeted, and everybody raised their hand and said, I want to hear about this. So I was the only workplace safety attorney from our firm that was present at that conference. So that meant I needed to stay up most of the night to learn about the coronavirus. It wasn't even a pandemic back then. So the next morning at 7:30 a.m. before our regular agenda started, I gave a presentation on the coronavirus, COVID-19. That was on February the 28th, 2020, which seems like a decade ago. But since then, I think I've talked to about 600 different companies and given about 54 different presentations about various issues that I've seen. And what I wanted to share with you is the best practices that I've learned from talking to those companies and how they've handled the pandemic, how they've treated their employees, how they've handled the public pressure that's associated with something so big like the pandemic. And I really tie it back to what Mark Cuban, the owner of the Dallas Mavericks, said back in May, I believe. And it's really what you guys do as a company, as an employer during this pandemic will impact your brand as a company for months, decades to come. So it's very important how you treat your employees. It's very important how you're viewed by the public. So we're going to talk about what I've seen work and what hasn't worked during this time period. What I like to really tie it back to is that there's really two things. You can talk about the law all you want. You can talk about sort of skipped over. There we go. So you can talk about, how am I going to comply with the law? How am I going to, comply with an OSHA regulation? And that's certainly something that you need to do. But every decision that you make during this pandemic, you need to think about how will it impact employee relations and how will it be viewed by the public. So you need to have those two guideposts as part of your decision making for everything that you decide to do throughout this pandemic. So we'll talk about that, but let's say, for instance, that you don't let somebody work from home who needs to care for their mother who has COVID-19 or is immune compromised, or let's say you don't pay for someone who's quarantined for 14 days. How's that going to impact employee relations, and how's it going to impact public perception? So you can completely comply with the law. That's what I've learned during this process. You can completely comply with the law, the regulations, the CDC guidance, but the decision that you make may not sit well with your employees or with the public. And those are things to think about. And to that end, employers tend to be not as transparent as they should be, and that really came to light during the pandemic. Communication to your workforce is absolutely crucial during this time. They're scared. They don't know what to do. They don't know what their rights are. They don't know what kind of leave that they may have available to them. So just go above and beyond and communicate to your employees. Make sure they understand what you're doing to keep them safe during this pandemic. What are they doing if someone has COVID-19? You heard Amanda talk about isolation and quarantine. What are your policies on that? What are your policies on cleaning and disinfecting the workplace? What are your policies on, sick leave and whether it's paid or not, or FMLA? All those things need to be communicated, because if you have a workforce that's ignorant, that doesn't understand what you're doing, they're more likely to be scared, they're more likely to file an OSHA complaint, they're more likely to not show up for work. So an educated workforce tends to be a happier workforce, and that's very important and something that I've seen throughout this process. Now, communication is a two-way street, and so you have to remember to listen to your employees. As managers and supervisors, we can't assume we know everything, especially about a pandemic, one that hasn't hit the United States in this fashion since at least 1918. So there's not a lot of people around that understand what it's like to go through this type of pandemic. So listen to your employees. What are their concerns? Not only just what are their concerns, but what are their ideas? Maybe they have really good ideas about some things you may be able to do at home or in a different fashion so that people are more socially distanced, or your policies and procedures can be changed. Maybe your procedures in the field, or where you're sorting vegetables or produce or whatever that might be. They may have ideas that you've never thought of before. So it's a good opportunity to listen to your employees and learn how you might be able to do your processes different and keep them safe at the same time. Now, in addition to be a lawyer, I'm not a really big fan of lawyers, to be honest with you, even though that's what I am. I like to read, I watch TED Talks and read a lot of books about business leadership. And one of the things that comes up time and time again is this idea of servant leadership. And the pandemic has allowed people to really take advantage of this opportunity to cast a light on those that they work with. Instead of saying, I'm the manager, I'm the supervisor, it all comes down to me. Look what I did to keep you guys safe through this pandemic. Instead, cast the light on those that you work with. Give them an opportunity to come up with ideas, listen to them about how we can do that process different. And when it's successful, then you really congratulate them and pump them up and make them look good. And just a hint here, when you do that, when you act as a servant leader, you're actually making yourself look better than if you would try to take all the congratulations yourself. So just keep that in mind. And companies really fall into two categories here. Either they're doing servant leadership on purpose, where they're actually trying to get feedback from their employees on purpose, or those other companies that I've seen that just simply didn't know what to do. They were caught flat-footed by the pandemic. And so they relied on new employees or younger employees or folks that maybe are not in a management position to give them these ideas and really let them have an opportunity to say what goes on. That's been very successful. So if you're doing it on purpose or you're doing it by accident, servant leadership has been present in all the companies that have been successful during this pandemic. And then, of course, I'm a workplace safety attorney, so there's been a lot of talk about CDC guidance, OSHA guidance, a lot of what Amanda talked about, the nuances there. During this process, talking to 600 different companies, I've handled hundreds of fatalities from COVID-19, from those that were 23 years old to 37 to 42, fathers and sons, It's been really an eye-opening experience for me, not just from a legal standpoint and what this pandemic has the impact it's had, but just as a human being about how precious life is. My birthday was last week. It really felt different to celebrate a birthday, so I'd encourage everybody out there, take care of yourselves, your loved ones, take care of your employees, because if this pandemic has showed me anything, it's that life is very, very precious. And to that end, with respect to the CDC guidance, a lot of employers have tried to comply. Some have done a really good job. Some have not. But with respect to those companies that have succeeded, they've really taken the time to figure out what's the CDC guidance, which one of those guidelines apply to my facility. Amanda talked about a lot of different variations, and we'll get into some of that from an employment standpoint as well. But really understanding what the CDC guidance is. And on the top, I've got the top 4 most misunderstood guidance that I've seen working with those 600 companies. And with respect to how this has played out, I was actually involved in the first fatality in the United States back in Washington State around the 1st of March. So I've seen how this is all morphed from that setting until we have 240,000 fatalities in the United States, and all the different nuances that the CDC has created and revised over this time period. So I know it's very confusing, but these are the top 4. Amanda hit on this perfectly in the Q&A, but it's that quarantine employee that's supposed to be out for 14 days. What if he gets a negative test on day 5 or day 7? As she noted, they cannot come back early because that is an incubation period. That's the number one thing that I see. In fact, I did a webinar earlier this morning, and that was still one of the questions that I got, but they cannot come back early with a negative test if they're quarantined. The second one is miscalculating the quarantine period if you have an employee that is living with an ill wife or spouse, a husband, a child, and they're around that person every single day. They don't have COVID-19, they've been tested negative, or they don't have any symptoms. There's no reason to think they have it, they're just exposed to it. Then that exposure period restarts every single day. So it's 14 days from the last day of exposure. So technically for your employees that are exposed, they may be out for 24 days because it would be the 10 days of self-isolation for the household member plus the 14 days of quarantine. And we'll talk about the nuances of that, how it may not apply specifically to your workplace, but that's a misunderstood guideline as well. And then not notifying employees of a COVID-19 case. We'll talk about when that's necessary, but our law firm is keeping track of all of the lawsuits that are filed because of COVID-19. And the number one type of claim that we see is that, when there's a COVID-19 case in the workplace, that the employer is not notifying the employees that work near that individual. Of course, they get scared because you're not communicating to them, right? You're not engaging with your employees, as I mentioned, and then they go and file a lawsuit instead of talking to you about what you're doing to keep them safe. So that's the third one. And then the last one is incorrectly believing that if you have a mask on and you're exposed to COVID-19, that exempts you from quarantine. So in other words, if you're within 6 feet of someone for 15 minutes or more, and we'll talk more about that later on, even if you have a mask on, even if the person that had COVID-19 had a mask on that you were exposed to, that does not exempt you from the quarantine period. So if you have a mask, if your employees have masks on, they still need to be subject to quarantine if they've been directly exposed. And that's one that a lot of people miss as well. So, why does this all matter? As mentioned, this is, I'm talking about the legal risk as an attorney and what I've seen with respect to the different types of claims. And I really like my buckets. I really like to divide things into buckets so that you guys can remember them. So with respect to claims and legal risks that you may face, they really fall into 3 different buckets. The first one is the OSHA bucket. If you have a quarry or a mine, it would be MSHA, but for most people, it's going to be OSHA. And really what we're seeing there is that, Johnny at your workplace is scared. You're not communicating to him. He doesn't understand what your sanitation schedule is. So he's going to call OSHA and he's going to voice his concerns. So the first thing you may get from OSHA is what they call a rapid response letter. So they're going to send you a letter. OSHA will send you a letter and say, we got a complaint about COVID-19 issues. Then you have to respond to that complaint in writing And if you don't have a COVID-19 response plan, you haven't done any training, you haven't done any communications, you're not, isolating sick individuals, it might be difficult to respond to that. The second thing is an inspection, which could be in person, which we're seeing a lot more of now that since about October the 1st, OSHA's going back out to sites in person. This summer, they were doing remote inspections where they would just call you and say, hey, we got a complaint about COVID-19. They could interview your managers, supervisors, your hourly workers, ask for documents. It's just a full-fledged inspection, but it's over the phone. So that's the second thing that we're seeing. And then the last thing are whistleblower claims. So OSHA's seen a huge uptick of whistleblower claims where Johnny gets fired because he complained about COVID-19. And then you have to go to OSHA and say, no, we didn't fire Johnny because of that. It was because of his performance. Well, if you can't document his performance deficiencies, or you can't document the COVID-19 response plan you have in place, or the communications and training you have in place, then it's going to be difficult to defeat that whistleblower claim. So that's the first bucket. The second bucket is the workers' comp bucket. So that's probably going to be the most common one that you see. Someone gets COVID-19, they claim it's at work, they file a workers' comp claim. Some states have come out and said that if you're in certain industries, it's presumed that COVID-19 was work-related. And then you have to refute that. So your insurance company is probably going to want to deny that claim. But if you don't have that COVID-19 response plan and you don't have that communication and training, it's going to be hard to defeat that. So that's the second bucket. The third bucket is the general liability bucket. And those are the rare cases where an employee will try to go above and beyond workers' comp to sue you directly as their employer. Those are very rare and only happen in situations where you're acting egregiously and willful. And I'm sure there wouldn't be any problems there. And that's a very rare case. But the more common sort of general liability is the third-party claim, where someone visited your site, whether they're a contractor, vendor, or a guest. They say they got COVID-19 at your workplace and they can sue you directly. Of course, you want to defeat that type of claim with just like you would defeat the OSHA claim and the workers' comp claim, and that's by showing your robust policies and procedures with respect to COVID-19. If you can't do that, it may be difficult for you to overcome a claim that someone got COVID-19 in your workplace. So what do you do to get ready to defeat those claims? Have a COVID-19 response team in place. That's the team that's in charge of making sure you have a COVID-19 response plan, that you are training your employees, that you are making sure those employees that have COVID-19 are isolated away from the workplace. And then also they go and they reimagine all your procedures and your policies. How can we do things different? It's that listening part of preserving your brand. Listening to your employees, how can we do things differently and keep everybody safe? That COVID-19 response team is also going to make sure that folks are social distancing in your workplace and wearing PPE where it's required. As Amanda mentioned, you want to take a look at any local or state orders that mention, temperature taking, questionnaires that may be required, social distancing or face mask requirements. Those are all important things that you need to consider as you come back to work and as you continue to come back to work. And then that written return to work program, I'll call it a COVID-19 response plan. I'll call it an infectious disease response plan. It's all one and the same. So important that you have that in place during this time, because it doesn't matter what type of legal claim there is. If you don't have one of those, it's going to be hard to show that you're taking all the steps you possibly can to keep your employees safe. So some other things to consider as you go back to work and continue to work during a pandemic. Make sure you have all the supplies and PPE that you need, gloves, goggles, face shields, face coverings, all the things that would be required depending on the tasks that the employees are doing. Are you cleaning and disinfecting? How are you going to do that? Are you going to train your employees on how to do that? You should, if it's above and beyond consumer usage. Are you going to screen your employees and guests as they come in for temperatures? Are you going to have them fill out a questionnaire as to whether they had symptoms? How are you logistically going to pull that off? What about carpool? That's really big in the ag sector. If you're using vans to transport people, how are you going to keep them separated? You're going to have them wear masks when they're in the van. How are you going to clean and disinfect that van on a frequent basis in order to make sure that it's clean and sanitary for the next use? And then training your employees and managers and supervisors. That is absolutely crucial. with respect to this COVID-19 pandemic. And what I mean by that, it goes back to the communication piece that I opened up with. If your employees, if your managers and supervisors are not trained on what your policies and procedures are, it really creates an issue, because when an employee goes to a manager and says, I want to know how often we're cleaning and sanitizing the workplace, if that manager doesn't know the answer, it doesn't sit well with the employee. They're going to be concerned and scared. They're already scared. And if they don't think you're doing a good job, then they're going to go to OSHA as opposed to you to voice their concerns. And then the second thing is that you just don't want your managers and supervisors to freak out when they're asked questions about the pandemic. You want them to have good bedside manners, just like when you go to the doctor or you go to a lawyer or you go to an accountant and you have a problem. It wouldn't sit well with you if they freaked out. Your professional help freaked out when you asked a question. So the same thing goes for your managers and supervisors. Just make sure they're well versed and they know how to respond calmly to any concerns that your employees may have. And then with respect to signage, make sure you have all the signs needed to show what if you're going to take temperatures, if you're going to have questionnaires, whatever that might be. You just don't want people to be surprised when they come to your facility as to what measures you're taking. And then with respect to OSHA, there is no OSHA COVID-19 regulation federally. There are at least 3 states that have adopted them: Virginia, Michigan, and Oregon. And we'll talk more specifically about the Virginia one as well. But there are other existing OSHA regulations that are tangentially applicable to this pandemic. And that includes PPE. Just like I said, are you having someone clean or disinfect? What kind of PPE do they need? Are you training them and providing them that PPE? Bloodborne pathogens, if you're taking temperatures and you have Sally from HR out there putting the thermometer in somebody's mouth, she could be exposed to mucus or saliva. If so, you have to have an exposure control plan. She has to be trained on that. She has to have the right PPE. Hazard communications. So we see this all the time with respect to emergency situations. Someone's using a cleaning or disinfecting agent that they've never used before. Maybe they're cleaning out that van that you're transporting folks out to the fields with. They don't have the safety data sheet. They don't have PPE, and that would be an OSHA violation if they're using a chemical above and beyond consumer grade. So just make sure you have a HAZCOM program in place. The infectious disease response plan, I mentioned that, is one and the same as that return to work COVID-19 response plan. Temperature taking, are you going to take temperature when your employees show up? Are you going to take temperatures when your guests show up and your vendors? How are you going to do that from a procedural standpoint? And we'll talk more about that. OSHA record keeping and reporting. OSHA says if you're required to keep OSHA 300 logs and you have a work-related COVID-19 case, that goes on your 300 log. We're going to talk more about the steps you need to take in order to see if it is in fact work-related. And then when do you have to pick up the phone and call OSHA? And there are times when you do with respect to the pandemic, whether it's a fatality, a work-related fatality concerning COVID-19, or an inpatient hospitalization. And we'll talk more about the wrinkles there and when you actually have to pick up the phone and call OSHA. And then finally, don't forget that OSHA has a general duty clause, which is their generic requirement that every employer provide a safe work environment for the employees. And the reason why that's important is because if there's a situation where no OSHA standard is directly on point, bloodborne pathogens, PPE, that's not directly on point, OSHA can rely on the general duty clause to say maybe the employer violated the CDC guidance. In fact, OSHA has already indicated that if an employer violates the CDC guidance, that OSHA can cite you for a general duty clause citation. And that's important for you guys in Georgia, especially because Georgia is a federal OSHA state where the federal government is enforcing the Occupational and Safety Health Act, and they can rely on the general duty clause to cite you guys for a general duty clause violation if you fail to meet the CDC guidance. So something that's important to remember. And one of the things that's very crucial there is that if you don't tell your employees about a COVID-19 case in certain situations, OSHA could use the general duty clause there. Okay, so let's talk about taking temperatures. Taking temperatures is one of those things where I do not necessarily recommend that unless it's required by a local or state order. And the reason for that is because having dealt with hundreds of COVID-19 cases, including my sister and brother-in-law and my nephew who all have it right now, about 80% of the cases I've been familiar with, no one ever had a fever. In fact, a lot of them were asymptomatic. So it doesn't do a whole lot of good, other than the fact, going back to what I talked about at the beginning, it helps with employee relations from an optics standpoint. So if you're taking the temperatures, people feel safer. But I will tell you, just be prepared for situations where folks test positive and never have any symptoms. So instead of taking temperatures, what about a questionnaire that you can do in person on a paper, or you can do it via email or via an app? The key is just to keep that information private. If you want to take temperatures still yet, but you want to keep people separated, there's an option where you can use a webcam and some software. I've got clients that use a software called FLIR, F-L-I-R. They can stay more than 6 feet away from the webcam. It'll measure their body temperature, and nobody has to wear PPE, and there's minimal training, and that takes away a lot of the issues that I mentioned earlier about exposure control plans and things of that nature. So that's one option. Maybe you want to bring a medical staff in, a contractor to come in and do the testing. But you also need to think about logistics. So if you have 200 employees that need to get out to the field or out to the plant before 8 a.m., how are you going to take all their temperatures from a logistics standpoint? Are you going to put a tent up outside? How are you going to keep it private when you can't collect that biomedical information? Those are all things you need to consider. And then one other thing is that with respect to the folks who stand in line to get their temperature taken or fill out that questionnaire, there's going to be lawyers out there that say while they're standing in line until they clock in that day, that is all compensable time. So just be prepared for that argument when they're in the parking lot and they haven't clocked in and they're waiting to be checked or screened. There's going to be plaintiffs' lawyers that say they should be paid for that. Well, you say, well, it's not that big of a deal. Well, 10 minutes times 200 employees times 5 times a week, it really starts to add up, especially if they file a class action. Then, of course, if you have temperature taking done at the facility, for your employees, think about guests and third parties. How are you going to do that? Certainly, it makes sense that if you take your own employees' temps, then you wouldn't want to do those for third parties in order to keep a safe workplace. Let's talk about face mask real quick. Now, I mentioned to you that I love my buckets, and the way I break down face coverings or face masks, or I've got my 3 buckets. So on the sort of the right side is the N95 filtering face piece dust mask. Okay, so those are the ones you see at Lowe's, or the filtering face pieces. They look like a dust mask. That's what people call them. Now, keep in mind that OSHA considers an N95 filtering face piece to be a respirator. Okay, and that's very important, because if you're requiring your employees to wear that dust mask, then you have to have a full respiratory protection program under OSHA, including doing fit tests and medical evaluations of all your employees that wear them. Okay, even if you have N95s worn on a voluntary basis, you still have to do certain things under OSHA's regulations. And I will tell you that we are seeing more OSHA citations for employers having employees wear N95s without fit testing, without medical evaluations, without the respiratory protection program, more than anything else. It's really a low-hanging fruit, because employers just don't understand that those N95 dust masks are in fact respirators according to OSHA. So I encourage you, if it's not required outside of the pandemic, I would stay away from N95 requirements. Voluntary use is a little bit easier for you to do that from a compliance standpoint, but I just want to make you aware of that. So the middle bucket is what you think of when you say face coverings. That's the surgical mask, the outside of a medical setting. It's the face coverings that you can buy anywhere. I've got my, you guys in Georgia probably don't want to hear this, but I've got my Alabama Crimson Tide face covering that I wear. It's designed to be a face covering. Okay, OSHA says that that's not personal protective equipment, not PPE. I don't necessarily agree with that, because I think it does provide some protection for you as the wearer, although most of the protection is for those around you. But on the screen, what I have is our firm's recommendation on that. It's not PPE, okay? But we recommend that you treat it like PPE for a couple of reasons. One, you're supposed to do a PPE hazard assessment in your workplace anyway. 2, it's going to bolster your safety program. And 3, it doesn't take very much time at all. So we encourage clients to treat it like PPE, so that's provided at no cost. Replace it within reason if it's worn out or causing a hazard. Train your employees on it real quick, a 10-minute donning and doffing training. Make sure that it's not causing a hazard to your employees. Do that PPE hazard certification that I mentioned. I can send a form to you. I'd be glad to. It's something that's required. And let me tell you something. If OSHA shows up at your facility, they're going to ask for those PPE hazard assessments. And I can guarantee you that 90% of employers don't do them, even though it's not certain, even though it's required. All right. So if you have those PPE hazard certifications done and they include the face coverings, you're going to look so good to OSHA when they show up that they'll be very impressed with your COVID-19 response plan, because a lot of employers will not do that. Okay. And then the third bucket is that bucket that includes those things that are not face coverings by design, like a bandana or a scarf. Those things would be a situation where the local or state order doesn't require it, but the employee wants to wear it, and you just have to make sure that it's not causing a hazard to the employees. Social distancing, social distancing is kind of like the grandfather of the pandemic. It's been around since the very beginning. It's a lot easier said than done. I don't know if, like me, I've been in law firms, and I've been in hotels, and I've been in poultry plants, and I've been on airplanes and everything during this pandemic. And it's very clear that it's hard to stay away from each other, no matter how many people are in a room. So, the first, that's just a couple ideas, a break room top left, using the painter tape to keep people separated. You've got the partition on the top right. There's a sneeze guard there. The bottom is, professional setting with a conference room, limiting the number of people that can sit there. And I did a lot of research on this, and there's an agency within the Department of Homeland Security that actually came up with the number of square feet that you need in order to safely social distance. And it's somewhere in the 120 range. I want to say 113, but it could have been 130. So it's in the 120 range. But you can take that 120 number or so and you can take the square feet of a particular room and divide it by that 120, and that will give you the occupancy level that you need, or that's safe for social distancing in any particular room. So just an interesting thing that I came across during the pandemic. And then also don't forget about, public areas, elevator banks, hallways, corridors, making them one way, limiting the number of people in elevators and restrooms and lunchrooms and break rooms. And then don't forget about non-spatial considerations like staggered shifts, staggered lunch breaks, other things that keep the number of people in the same space to a minimum. That's very important as well. All right, a few other things that we see pop up, common questions. The big thing back in March and April was that I'll just get everybody to sign a waiver. The employees just sign a waiver. They can't sue us. They can't file a workers' comp claim. They can't file an OSHA claim. That goes back to the original, how's that going to sit with the employees, and what's the public perception, right? So the first thing is that it's not legal. OSHA is not going to enforce it. Workers' comp is not going to enforce it. And then even worse, your employees are going to be scared to death. And second, it's going to look bad from a public perception standpoint. So what do you do as an alternative? You do an acknowledgement. So you have that written COVID-19 response plan that I mentioned. It's like a second employee handbook. So you have the COVID-19 handbook, you give it to your employees, you train them on it. It tells them, here's the protocols and procedures. And at the end, they sign off on it, just like the employee handbook, and say, I understand what the procedures are. I understand what the risks are. I'm going to follow this guidance, and I acknowledge the receipt of this policy. And that will be much better for employee relations, because you're communicating what the issues are. They're going to understand how you're going to keep them safe. And it may help you if there's any of those types of claims filed that we mentioned earlier. What about an employee who refuses to show up? OSHA has a very high threshold for that. It's so dangerous, I don't even have time to call OSHA. You're not going to see that very often. So the key is just communicate with your employees, tell them what you're doing to keep them safe, and they should be coming to work if they feel comfortable. But if not, you may have that situation. If you're doing everything you can to communicate with them, and they just won't show up, just because we're in a pandemic doesn't mean you can't discipline them. But just keep in mind those two things that I mentioned at the beginning. employee relations, and public perception. Fitness for duty exams. So, COVID-19 tests, you can certainly do that. Amanda did a great job with that. You can certainly take temperatures of employees. You can still do DOT, drug testing. You can still do any other fitness for duty exams required by any other regulation or statute. And then have a policy in place that you follow when you have an employee with COVID-19. We're going to go over that specifically, but that's very important to make sure that this COVID-19 doesn't spread. Now, antibody testing, the EEOCs, you can't make that a condition of coming back to work, having a positive antibody test or taking a test. If you're using a test to see if someone has COVID-19, make sure it's FDA compliant, including an emergency, what they call an EUA, an emergency use authorization. So if you're giving a test to employees, make sure it is FDA compliant. And also, think about, it's almost one of those, it falls into the category of be careful what you wish for to some extent. If you test all of your employees, we've had situations where 100% or 91% of employees were positive, whereas less than 10% had any symptoms. And the reason for that, as Amanda did a great job of describing, is that even if you're asymptomatic and you're positive, most of the time you're going to be out for 10 days under the CDC guidelines. So just keep that in mind. Also, if you're collecting biomedical information, temperatures, symptoms from employees, you want to keep that information private, separate from their personnel file under the EEOC. If you're operating in California, you have to give employees a notice before you take their temperature. They don't have to sign off on it or anything like that, but they have to have notice that you're taking that information. So just be aware of that. And then this is probably my favorite slide of the presentation. This is the 4-step process when you have an employee that's sick with COVID-19. And I always call that person Johnny, just so you guys can remember. Always pick on poor Johnny. So Johnny has COVID-19. I'm going to send him home, most likely out for 10 days under the current CDC guidance, as Amanda did a great job of describing. And then after Johnny leaves, we're going to call him and we're going to say, we need to figure out who you were close to right before you got sick or you went home, right? And back in March, April, and May, I kept talking to a lot of folks about what do we need to do if you've been exposed to COVID-19. You go through the CDC guidance, and finally, just one day it clicked for me, and it just said, it's a 6-15-48 analysis. So I came up with this 6-15-48 analysis. One of the things that was just crazy, but it's interesting. The National SHRM has now picked it up as an official protocol for employers, but it basically goes like this. So with respect to Johnny, so Johnny's sick, and then you call Johnny and you need to say, I need to know who the 6-15-48 employees are, okay? So those are the employees that worked within 6 feet of Johnny for 15 minutes or more, and as Amanda mentioned, that's cumulative 15 minutes within any 24-hour period during the time period of 48 hours before Johnny had symptoms or he was tested if he had no symptoms until he's released from self-isolation. So that's what you call 6-15-48 analysis, all right? Those are the ones that have been directly exposed to Johnny, all right? So you've got 2 options when it comes to 6-15-48 employees. For a lot of companies that are just general businesses, those 6-15-48 employees need to be quarantined for 14 days, right? And that's even if they get a negative test. They can't cut it short on day 3, 5, 7, 11, just as Amanda said. They cannot cut that 14-day period short. However, if you're a critical infrastructure, which a lot of the ag folks would qualify for, then the 6-15-48 employees can continue to work as long as they don't have any symptoms, and you do these 5 things. You put them in a mask for 14 days. You have them social distance from everyone else. You screen them before they come into every shift. You have them self-monitor for symptoms at home a couple times, and then you clean and disinfect the workplace regularly. Okay, if you do those 5 things, those 6-15-48 employees don't have any symptoms, and your critical infrastructure, then those employees can continue to work. And that's crucial because what we're seeing right now is this uptick of cases. We've got a lot of critical infrastructure companies that haven't been doing that. But now that they have so many people out for 14 days, they're like, hold on a second, I didn't realize I could do that. So that's one of the things that's been around from the very beginning. And I encourage you to the extent possible, and something that you want to do. You can look at the critical infrastructure if you qualify for it. But I will tell you, if you haven't been doing it all during the pandemic and you want to switch over to it, I would encourage you to set it out 2 to 3 weeks so you can communicate to your employees what you're doing, why you're doing it, why it's compliant with the guidelines, and then roll it out that way. Because if you do it on a dime overnight, people are going to be scared and they're not going to know what's going on. So the third thing, clean and disinfect the workplace. You got to clean and disinfect where Johnny worked, his cubicle, his area. You got to clean and infect his common areas where he used the restroom, the break room, the lunchroom, wherever that might be. And then anywhere else he might have touched, common area, common touch surfaces, elevator buttons, railings on stairs, things along those lines. And then the last thing is to notify your employees. Okay, so we've got the buckets again, right? We got one bucket, that's Johnny. The second bucket, 6/15/48. And then we've got the last bucket, all the employees who may have been exposed to Johnny but are not 6/15/48. All right. So by this point in the process, Johnny knows, obviously. 6/15/48 employees know. And then the last bucket, we need to tell them that they may have been exposed to a confirmed case, but we can't disclose Johnny's name unless he waives it. Just to let them know that they may have had exposure. There's no direct exposure to them. If they have any symptoms, seek care of a physician. If they have any questions, call Sally in HR. That's very important. I talked about OSHA's general duty clause, and I talked about the lawsuits that are being filed because of the failure to do that. And then 2 more slides, and then we will get into some questions. With respect to 300, OSHA 300 log recording of COVID-19 cases, all right? So back in April, OSHA started off and said you only had to do a work-related analysis if you were in healthcare, a detention center, or emergency responder. Okay, so that was shelved very quickly after some feedback. And so in May, on May 19th, OSHA said effective May 26, 2020, all companies that are subject to 300 logs have to do an analysis to determine if Johnny's case is work-related. And we boiled that down to 3 steps. Ask Johnny, where do you think you got COVID-19? He may make it real easy and say, well, I got it down at my cousin Bubba's barbecue last weekend. Okay, not work-related. Then you ask Johnny, is there anything at work that may have led you to get COVID-19? Were you around a coworker that had COVID-19, or around a member of the public that had COVID-19? And it's interesting what you'll get. My favorite one that I've gotten so far from this is that this one employee was adamant that he did not get it at work because the only 3 places he had been in the last 14 days were Walmart, Dollar General, and the dirt track because he did dirt track racing on Friday nights. So he was adamant that given that he'd only been to those 3 places, there was no way he had gotten it at work. So you'll get some interesting things there. And then the last thing is you actually take a look at Johnny's workplace and say, was Johnny around someone with COVID-19? Was Johnny around somebody in the public with COVID-19? Once you've done those 3 steps, then you can determine, is Johnny's COVID-19 case work-related or is it not work-related? If it is work-related, it goes on the 300 log. And if it's not, you just have a memo in the file so that if OSHA ever does an inspection, you can say, then they ask, why didn't you record Johnny? You can say, here's the analysis we did. And at the end of the day, OSHA is not going to worry about if you have Johnny's case on there or not. They're going to worry about whether or not you did that analysis. And then the last slide, we're going to talk about OSHA reporting, which applies to everybody, even if you don't have to keep an OSHA 300 log, okay? So this is when you pick up the phone or go online and you report a COVID-19 case to OSHA. And for the purpose of these hypotheticals, they're all work-related, okay? And I boiled it down to these 4 hypotheticals so you can better understand because it is quite convoluted. So Johnny has COVID-19, he gets medical treatment beyond first aid, or he misses a day of work, but doesn't go to the hospital. That's recordable, OSHA 300, easy. Don't report it, only record it. So what if Johnny has COVID-19 and then goes immediately from work to the hospital and is hospitalized within 24 hours for work-related COVID-19? That it goes on your 300 log, and you have to call OSHA because it was an inpatient hospitalization within 24 hours of a work-related incident. Third hypothetical, this is the one that's the most common. Johnny has COVID-19, work related. He goes home, he's hospitalized 2 weeks later, okay? Not until 2 weeks later. Now that one goes on your 300 log, but you do not have to call OSHA. You'll say, Travis, you're crazy. He was hospitalized. Well, it doesn't matter because the hospitalization has to occur within 24 hours of the work-related incident. We've had a lot of companies call OSHA when they in fact did not have to. So that's very important. And then the last one, unfortunately, I've had to call some of these in myself, and we do see more and more of them. But Johnny has COVID-19. He goes home. He's hospitalized 2 weeks later, and then he passes away within 30 days. You have to call OSHA and record that one. And the reason for that is because if a fatality happens within 30 days of a work-related incident, it's reportable, whereas the hospitalization has to be within 24 hours. So hopefully you can gain a better understanding of OSHA's reporting there with respect to COVID-19. And with that, I will turn it back over to Beth or whoever may be the moderator, and we'll take some questions. And if anybody has any questions, if you would like a model COVID-19 response plan, if you would like a copy of a decision tree to do that work-related investigation for OSHA 300 logs, just send me an email. I'll be glad to send you a copy of that. So with that, I'll turn it over to you, Beth. Thank you very much.
Thank you, Travis. Thank you. This was fantastic information. I feel like the two presentations with Amanda and the regulatory approach, and then your best practices and what you've really seen boots on the ground has been a really robust approach to COVID-19, and very specifically in our ag labor place. We do have a couple of questions. The first one, I think I sent you, are you aware of any sources for COVID signage similar to DOL signage or posters?
There's some posters that you can get online from the DOL and the CDC, but you could just basically send whatever you want to your regular signage vendor, and they should be able to come up with that.
Thank you. Yep. And then what are the 5 things a critical employee must do to stay employed with no COVID symptoms?
Right. So you have to have them in a mask for 14 days, social distance them from other workers, screen them for symptoms before each shift, have them self-monitor each day for symptoms, and then clean and disinfect the workplace.
That's fantastic. So I think that really hits on something that I want to underscore, and I want you to help me with this. Isolation occurs when someone has tested positive. You know that they're positive, there's no question. Correct. So if you're positive, you then go into isolation.
Correct.
Quarantine, on the other hand, you have not tested positive. You've simply been exposed to someone who is positive. Is that correct?
Absolutely. So it's 10 days. You can remember 10 days isolation. That's a positive test. 14 quarantine exposure. So it's 14 exposure, 10 positive test. So it's two different. And Amanda had a good slide there where it broke down isolation versus quarantine. But isolation's 10 days, quarantine's 14. And the reason for that is because the virus will run through your body quicker if you're positive than it will if and then it takes to set it up. So in other words, it'll run through your body in 10 days, but it may not set up in your body for 14 days if you've only been exposed, because the incubation period is very long. I've been waiting on the CDC to go to 7 or 10 days on quarantine, but they never have. And I think they've been doing some tests on it, but they haven't found that it's safe, because most people get it between 2 and 14 days after exposure, with the average being 5.
Got it. So everybody, again, if you have questions, make sure that you type those into the question box. We do have a few more. So staying on that quarantine, again, with isolation, you cannot test yourself out of that 10-day isolation period. Is that correct?
Well, so the 10 days is when you have COVID-19, right, for isolation. So you could technically test out, like Amanda said, with the 2 tests more than 24 hours apart. But the CDC doesn't recommend that anymore. But on the 14-day quarantine, you cannot test out of that with a negative test.
Got it.
Unless you're critical infrastructure, and then you can do all those other things that we mentioned.
Right. And then the last part of the quarantine, just to underscore and make sure that we understand well, is your quarantine, if you're at home and you're caring for someone who is positive, your 14-day quarantine period really begins your last day of exposure to that positive individual.
Right. So you can have a situation where it's 24 days if you've been around it every day for 10 days. And so that person is going to be released on the 10th day. And then your first day of quarantine starts on the 10th day. So that's how you get to 24. So I'll tell you, for most of your ag folks, and you can see where we're heading with this, but the critical infrastructure guidance is critical for you guys, because you're really going to run into staffing issues with quarantines.
Absolutely. So it's fantastic that we definitely fall into that critical infrastructure where, again, no symptoms and people can continue to work as long as they follow those 5 different steps. I have another question here that I just sent to you from Tanya. If an employee has more than one instance of possible COVID exposure and is out multiple times, do we have to pay them the 80 hours sick pay each time?
Yes, so the 80 hours federal regulation is it's capped at 80 hours, so you don't have to pay them more than that. So they only get it one time.
Perfect. Okay, thank you. So another question that we've been getting a lot here is the PPE, and very specifically glove availability. With any of the clients that you're working with, have you run into gloves not being available and or the cost of those gloves just being astronomical at this point in time? And what may be some of the mitigation steps that y'all have taken with that?
Yeah, I mean, with respect to just, they are more expensive. I actually have a client that actually is a startup, and all they're going to do is produce PPE because of the pandemic, because there's such a need. So the cost has gone up, but I will tell you that, think about when you're looking for folks that have PPE, think outside the box. So think about your insurance broker, workers' comp, commercial general liability. If you have someone that helps you with real estate needs, reach out to those folks. We have found that they have access to a lot of vendors that have PPE. To the extent possible, you can reuse PPE as long as it's not, creating a hazard. So if that's possible, you could see if you could reuse PPE. I know it may not be possible, especially with some types of gloves, but just see if that's possible and continue to reuse them if you possibly can. And then I would really reach out to your workers' comp, your insurance broker, maybe a real estate professional, because we found that those folks have got ties to a lot of PPE vendors. And you'd be surprised, there's a lot more available out there than you would think at this point.
Awesome, thank you. Okay, and I think one of the last questions that I've seen, actually another one just came in, employers, just again, a clarification, on your slide, and you mentioned that employers cannot require a negative antibody test for an employee to return to work. Does that apply to any negative test? So if an employee has fulfilled that 14-day quarantine period, can an employer require a negative test before they allow that employee to come back to work?
Yeah, you can. That's only for antibodies, because the EEOC says that that's basically a medical examination that's impermissible. But I will tell you, if someone's out for 14 days and you require a negative test, that's certainly fine. If you do the 10 days, like Amanda said, do the 10 days and then require a negative test, you can do that. But what you're going to run into is folks that don't have any symptoms that might continue to test positive for 20 or 30 days. And that's why the CDC says, as long as it's been 10 days since they first had symptoms or they were tested with no symptoms, they can come back. So just keep in mind, because we've had folks that are out for 30, 40, 50 days because they keep testing positive and they don't have any symptoms.
Okay. I've got Susan with a follow-up question to the 80-hour of sick pay. If you have an employee that is part-time status and they are out of work due to a positive COVID, do we owe them up to 80 hours of sick pay?
Yeah, that's with the part-time, my understanding is it's just the rate that they're paid. So it would be a lesser rate, but it would be up to the 80 hours.
Got it. Those are all the questions. Great questions. I want to encourage everybody to take Travis up on his offer. I know that there was the PPE hazard assessment form that came in, or that he has offered, as well as some other hazard assessments. So if you've got questions for him, or if you just want to reach out, his contact information is on the screen. It's also in the handouts portion of your control box. You can go down there and you can download this entire presentation. Actually, we've got a couple more questions that came in. Once you get a vaccine, once a vaccine is available, can you require or strongly recommend an employee get it?
Yeah, you can. We have done an article, our website, our firm has actually got a whole vaccine resource center if you want to take a look at that, but you can accept if someone has a medical accommodation or religious accommodation, something like that, there would be exceptions there.
Okay, excellent.
We'll hope that it, we'll get one in probably this spring, hopefully.
Yes, that would be nice. I tell you what, why don't you and I work on maybe getting that article, and we'll send that out to all the attendees later today. So excellent. Thank you, Russell, for asking that question. Well, with that, we have reached the end of our time together. So thank you very much. Thank you, Chris. Thank you, Amanda. Thank you, Travis, for walking us through these issues with COVID-19 and our ag labor. Again, this is the second of our 5-part series for the 2020 Georgia Agricultural Labor Relations Forum. As a reminder, this was a recorded webinar, and all attendees will be receiving access for on-demand viewing later. Please remember to come back in 2 days, next Thursday, November the 12th, for H2A and the USDOL updates. In closing, I just want to again thank Amanda and Travis for sharing your time and your expertise with us, and for navigating us through these tenuous topics and participating in this webinar. Additionally, I want to thank each one of you for joining us. Additionally, please feel free to contact the Georgia Fruit and Vegetable Growers Association if you have any questions. We'll definitely make sure to direct you to the right subject matter expert or other trade association that's going to be the best help for you. And again, don't forget to download the slide deck from the handouts box on your webinar control panel. So thank you for your participation in this webinar. This concludes the second of 5 days of the 2020 Georgia Agricultural Labor Relations Forum. Have a great day.